All right, we are back. It's now HESI review time. Okay, so like I said, I'll share the PowerPoint with you on the screen. We'll go through it. There should be a Kahoot that I will be sending out to you guys. That's a good HESI review. Just remember, HESI is not written by us as professors. So we only know what the topics are, but we're not going to know specific questions, okay? A good study technique that I've heard from fellow students of yours is to use your NCLEX book. There's a community section in there. They have questions, so you can kind of do that. There will be math on there, calculations. So what do we need to make sure we have? Every single one of us has.
A whiteboard.
Whiteboard. They will not let you take the HESI without a whiteboard, is my understanding. So if you don't have one, go on Amazon and order one, okay? Because just you'll have to do math and you'll have to write it
So are
down.
we taking it online? Are we taking it online?
Is there any retakes? No.
No, are we taking it online like our usual
It
time?
depends on your campus. I can't speak to every campus. I don't know. Some campuses make you come in person and some make you do it via Zoom. Salt Lake City is the only one I know that was doing Zoom. But don't correct me. Elizabeth, what's your campus?
Cincinnati.
Anybody else in Cincinnati?
Yes, we usually have to go in person for
Okay.
class time.
Okay, so if you have not gotten the schedule, I suggest you reach out to your dean. Okay, your dean on campus. Good? And the HESI is a one-time go, so just study up, guys. Do the best you can. Tonight's quiz was sort of like a review of HESI. If you guys notice, it was like questions all over the place. That's kind of what you're going to have. What we have been told is the HESI for community is very med-surg heavy. Okay, so you're going to really use your med-surg skills in a community setting. Anything else before we start the review? I feel like I'm forgetting something. All right, well, here we go. I'm going to share my PowerPoint. All right. So everybody can see this. We're going to start with, what does public health do? This is a question that comes up a lot. Why do we do public health? You guys should know at this point where our goal is prevention, right, of disease and disability. It's ensuring the conditions that exist in which people can remain healthy. Why do we do this? We focus on the population. It's population focused always, right? We work to understand the problems and solutions of certain populations, certain ages, certain races, right? And the population of the world is increasing, right? Due to increased fertility rates. This brings us back to our first test. Population of the world is increasing due to fertility rates and decreased mortality. People are living longer. We have advances in healthcare. We have vaccines. We have screening tools. We have medications. We see health disparities, which is our largest impact is economics. You have a higher chronic disease and less follow-up with our vulnerable populations. What do we know the relationship between economics and healthcare?
Like poverty, they have more health conditions. Is that what we're asking? I think.
Yep.
Worse
Perfect.
outcomes.
Yeah, poor outcomes. We want to keep in mind it's not necessarily they want the poor outcomes. They just have them because maybe lack of follow-up, lack of screenings, right? You're going to see your primary, secondary, and tertiary coming through with your HESI. I'm going to make this big so you guys can see it. Come on. So that's something important. Let's look at our slideshow. Oops. What else can I tell you? From current slide. Okay. So we know what public health does. We take a look at a comparison of healthy people 2000, 2010, 2020, 2030. What is our goal for healthy people 2030?
To help limit like comorbidities, like prevention of things like that.
To stop preventable diseases.
Yep. What else?
To educate.
Educate, we want higher health outcomes, we want better health outcomes, right? So Healthy People 2030 gives us rules, sort of guidelines of what we can do to make ourselves healthier human beings, which takes us right to evidence-based practice. You guys are probably over hearing about it, but what can somebody tell me about evidence-based practice? What's just anything you think of when you hear that word?
Something that's been like, it's measurable, like scientifically proven.
Resistance.
Good. Say that again.
Resistance. Like
Yep.
employee resistance.
Very good. You see a lot of resistance when you try to implement something different, right? With our quality improvement. What else do we know about evidence-based practice? What do we have to, oh, there's a spelling error on that. What do we have to do before we start studying something?
Know the boundaries. Is that what you?
No, good. I like that.
Research.
Let's,
Research.
well, before we even start researching,
Like collect data,
what kind of data?
like about the people, their community. I think I'm missing a whole bunch of them.
No, you're good. You're on a start. Somebody help her out here. Other than the community and the people, what else are we looking at before we start studying or researching
Are
something?
you talking like a question?
Boundaries.
Yeah, you need to know. Good, Jessica. You need to know, what am I going to study? Right? If you don't know what you're going to study, that'd be an interesting research study, wouldn't it? I don't know what I'm studying, so let me just sit here and do nothing. That's about how that would go, right? So good. So I want you to think about that. Clinical trials, big deal. I don't know if anyone has had the experience of a clinical trial. I have had personal experience with it. I think lots of times the point of a clinical trial is not for that person that's involved in it. It's for the people who are to come afterwards. Okay. So they'll do a lot of like cancer clinical trials. And my mom did one of
You're frozen. Or y'all can hear her.
for
I
people.
don't know, but for a minute there I thought I
She
got
was
lost.
no, she was frozen. She was
Yeah,
frozen.
I can hear
Okay.
you.
All right. So we just said clinical trials. That's all we were talking about. Did you guys hear that?
No, ma'am.
Okay.
You was froze.
Froze again?
Mm-hmm.
Okay. Can everyone hear me now? Just give me a thumbs up. All right, my internet should be good. It was the cord that was the problem. So if we don't have bad internet, but all I was saying is clinical trials are done. Sometimes they're very emotional. Sometimes they're not done to help the people that are doing them. Sometimes they're just exclusively for research to help people after them who have the same condition. Okay, does that make sense to everybody? So when somebody's in a clinical trial, it does not mean that it's going to fix them. Some people will offer to be in clinical trials in the hope that the medicine will help, or, the surgery will help, or whatever. Okay. So just keep that in mind when we're looking at that. Deep breathing. We're not going to go through that. You guys know how to deep breathe. Patient rights. Remember, unless a patient is declared incompetent, the person should have the right to self-determine, right? Who manages their healthcare, who manages their finances. What ethical issues do we see related to abuse and screening? What kind of things do you think you might see there? What kind of ethical issues with abuse and screening?
Like, are you saying if you're screening a patient, like abuse symptom, like symptoms they might show for us to think that they're an abuse case, or no?
Could be. That's ethical, right? If we see that happening. What else could we see with screenings and abuse?
Talking about like personal biases.
Good. Personal bias, that's another one. Good. Ethical issues. Think about when we're doing these screenings, is it always minimizing the risk? Is it always benefiting the patient? Right? So even though we suggest a colonoscopy every 10 years, if the patient says, no, I'm not doing it, what do we say to them?
We say
They're
okay.
right.
We giving them the facts to where they know, all the details to it. If that's what they want, that's what they want.
Good. So we support their choices, but we also make sure that we educate, right? As nurses, that is our goal, to educate our patients so that we know they are aware. I just saw a meme the other day and it said, thank all the nurses because they help the doctors from making mistakes, right? And we can laugh because we're, you guys are almost nurses, or if not LPNs, but aren't nurses always the ones? And when you're in labor and delivery, I was in labor and delivery for many years. It was me who was up at 3 o'clock in the morning taking care of the patient. The OB was in the room sleeping. So think about how important we are to patients and educating and taking care of. Okay, we are priceless. All right, so we look at goals, self-care, capacity, managing chronic diseases. We're going to try to give everyone the highest quality of life. This touches on hospice a bit, right? We let them die with dignity. That's how we remember it. We look at our primary focus of community-based nursing. Okay, and that's the care of the individuals. Remember, community-based nursing is going to be with our chronic conditions, and our community-oriented is where we're going to take care of that community. We're going to care for the individuals and families, and we're going to see what are they at risk for. Okay, so one is more chronic and one is more, let's take care of them, let's do our screenings. I don't know what that's a picture of. All right, our ethical decision making. We went through this before a previous test. I'm going to be quick on it. Just know we have our principles that guide our healthcare. We have feminist ethics, which is political and social structures that affect women and others. So like the right to vote is a good example. What else do we have here? All right, community. This is one of your questions on your test. Select all that apply. Refers to the dimensions of people, place, function. When we look at the dimensions of a community, we're looking at things like census data, right? Who lives here? How old are they? What do they do? We look at tourist bureaus. We look at civic groups. We look at churches. We did our parish nursing chapter. That's where that kind of focuses. The dimension of place would be measured with sources like maps. We know community assessment is going to look at politics, economics, education, recreation, religion. We have active community partnerships, which are those that focus with community leaders and businesses to help our healthcare providers. So they're actively being a part of our community so that things are getting done. So a program in a school with low-fat snacks is always going to be an example there. Case management. What do we know about case management?
They help with providing like resources to patients and their families.
Good. They help with resources. What else do they help with?
Continuum of care.
Good. Continuity of care, right? It's going to be that they get everything all coordinated together. They make the appointments, they schedule and call the specialist, right? So I want you guys to remember that every plan that a case manager has is going to be independent. We always work with every team member to make sure they're taking care of our patients. And we always remember ABCs always. Quality assurance and quality improvement. We just went through this. This was just on our test. There's different phases. The first phase of a quality improvement program, this was a question on your exam, was the structure phase. And that's where you figure out what does everybody do and why did they do it? Okay, because before you can plan to change something, you got to figure out who's the players in the team, right? You're going to prioritize. Oh, this is strategies for successful skip. Okay. School nursing. We talked about that. That was a big one. Stomach aches. What do we know about stomach aches in schools?
Can it be a sign of anxiety in the kids?
Good. Anxiety. What else?
Hungry.
Yep. Hungry. What else?
Like knowing whether it's an actual symptom or they're just wanting to go home.
Yep. Good. It's an excuse to go home. So could it also be a sign of something going on at home? So I want you guys to think about, maybe they're bothered that something happened last night at home. And so you have a stomach ache. I don't know if you guys have ever had one, but I've had one. When I'm nervous, my stomach hurts. Not too bad, right? But so remember, when we're thinking of these things, put yourself in the situations. Headaches, I get them all the time because I don't have my glasses on, right? ADHD, another one we're going to treat in the schools. Be very careful with that. And pink eye, we see those frequently. Here's some more stuff. We have our scoliosis. Don't forget, we're evaluating for lead poisoning in our kids, right? And one of your questions on your exam was about which of the following, I think it was a secondary prevention for lead poisoning. What would be a secondary prevention for lead poisoning?
The screening test they have to get at their checkups.
The
Good.
blood
The blood
level
test.
of
Yep.
lead.
Yep, exactly. Good. I don't know, you'll have questions on psoriasis. Eczema, just know this is a skin condition that kids have. So if they show up with it, sometimes it's emergent, sometimes it's not. Could be chicken pox. Unfortunately, we're seeing a rise in measles right now. Very sad. We hadn't seen measles in years. And now children are dying from measles. Why do you think that is?
A lot of
Parents.
people aren't getting vaccinated.
Yep.
Yeah. Either they're not getting vaccinated, or it's not that they're intentionally not, but maybe they're coming from another country and they don't vaccinate for that, right? Or maybe they're coming from an underdeveloped country where doctors are not educating them or nurses are not educating them, right? So as soon as we see this, what we should be doing as community nurses is what? What should we do when we see something like this start popping up?
Educate and encourage for vaccination.
Good. We also want to run data, see what our population, what our community, how many are vaccinated. You can always find that in a school setting. Some are not vaccinated, some are vaccinated. You want to know your percentage, right? To know what are your risks and who's at risk, right? And so be very careful with that, okay? Very careful with those kind of things. And our immunizations are what kind of prevention? Primary, secondary, or tertiary?
Primary.
Primary.
Yep. Your vaccines are always primary. All right, we take a look at teen health. We talked a bit about this with different ages and what the different ages we see, right? And anybody who has a teenager, we know what's going on in the world. They don't think we know anything, but as nurses, I want you guys to remember that mental health is a huge concern right now. There's a lot of money and effort being put towards mental health. Substance use, big old one. What's the most popular thing right now among teens? Does anybody know?
Is it maybe
Vaping.
yeah,
vaping.
that's what I was gonna say. It was vaping.
Yep. Vaping. And the interesting thing about vapes is you don't know, does it have marijuana in it or not? So if you see a kid vaping, you don't know what he's got going on, right? And what do we know about the vape oils? Are they safe for kids?
They're toxic.
Yep, they're toxic to little people. STDs, we worry about that with our teenagers because they may not use protection. So we're going to definitely educate them on that. Homelessness, we know we have a large homeless population, homicide and suicides. All right, our addictions, what do we know about addiction? That we often see it's a pattern, right? We see they're preoccupied with the use of a drug or alcohol and they must have it all the time. High relapse if the drug is taken from them. So what are we going to try to have them do? We're not just going to take it away from them because there's a high rate of reoccurrence if we do. What could we do?
Like weaning them off of it?
Okay, weaning them off. We're going to give them autonomy, right? Let them make those independent decisions. We're not just going to take it. Because what do you think is going to happen if you take someone who's addicted to drugs, their drugs away?
Want to find another way to get it?
Yeah, they're going to find another way to get it, right? If they don't want to stop, right? So we know they're at high risk.
Professor,
Yep.
Jassiny told me to tell you she had to hop off and she apologized. She said she was having an allergic reaction. She told me to tell you real quick.
Okay, thanks.
Uh-huh.
STDs, we talked about bacterial and viral. Know that our syphilis crosses the placenta, right? So we worry about our babies with that. We have different types. You guys did a whole bunch of research on infectious disease. All right, we're going to go through primary, our prevention. We're going to educate. We're going to provide vaccines. We're going to see this at the local health department, clinics, rural health units. All those are going to do our primary prevention. Our TB screening. Everybody remember this? What's our measurement?
10.
10.
Yeah, 10. If they're immunocompromised, 5. Right? Chest x-ray to follow. And as long as chest x-ray is negative, then you're fine. Where do we see TB spread?
In
Close
what do you mean,
contact
like close
areas.
quarters? Close
Yeah.
quarters?
Yeah, good. Close quarters, like a prison, right? A dorm, something like that. All right, our tertiary prevention, we know is our rehab, our specialized care. We use our specialists. We have sophisticated equipment. We see this oftentimes in hospitals. We could also see it in medical centers and doctors' offices, right? Or tertiary care. We're managing our disease or our problem. We're treating something that someone has. So make sure they have a condition before you go to tertiary. We have 2 different types of government-funded insurance. We have our Medicaid, which has the word aid in it. So it's giving to those people that have low income or unable. We have Medicare, which is going to be our 65 and older. Okay. And they have different regulations. Remember, Medicare, you have to have nursing care. They'll let you have in-home. Medicaid will not. Medicaid will let you do whatever. Homelessness. Whoa, this is a big topic. What do we know about the homeless? Nothing.
That they won't return for treatment or for follow-up. So we try and give them the most supplies as we can to take care of themselves and teach them how.
Good. We're going to teach them how to take care of themselves. What else?
They're at risk for chronic diseases.
Say that again.
They're at risk for chronic diseases.
Yes, very good. They're at risk for those chronic illnesses. What else do we know that we see in the homeless communities? Remember, we see mental illness as a big piece of this community. So we're going to try to address that. Where do they get their care usually?
Emergency room.
Emergency room.
Yeah. So this is a problem, and a problem because a lot of times they'll come in to get care, and we talked about this in class, but they come in to get care, but they're really looking for a warm bed and food. So it becomes multifaceted when they're in the ERs, right? Vulnerable populations, we spoke to this to nauseam. Think about, why is this important? Why do we worry about our vulnerable populations?
Because they're the most at risk for illness and disease.
Yeah, yep, they have the highest rate of illness and disease. Poverty, homeless, teen pregnancy, mental health, all topics we've covered quite a bit in this class. Pregnant teens, we know there's an increase in single motherhood occurring. Biggest thing with a pregnant mom is keep her in school. We know the relationship between poverty and health outcomes, right? So you want to keep them in school, keep them, a lot of times now we have programs online, right? So we can keep them in school that way if they need to. Oh, occupational health nursing. We had a whole chapter on that. Let's see. It's a specialty type of nursing. We know that it's very autonomous, right? They can work on their own most of the times. We think about in the hospitals, it's those employee health nurses, that's what they're called. So what kind of prevention are we going to do as an occupational health nurse? We're going to mitigate the risk for our employees by wearing appropriate gear. We're going to educate. Secondary, we're going to screen and see if there's any disease. And once they hurt themselves, then we're going to rehab them and restore them. OSHA goes with our occupational health nursing. It's the Occupational Safety and Health Act of 1970. We know it helps to promote safe and healthy working conditions, right? So OSHA has a database of all things that have happened. We have different government agencies in healthcare, right? The World Health Organization, our Agency for Healthcare Research and Quality, our Center for Disease Control, and our HRSA, our Health Resources and Service Administration. Remember, our World Health Organization does a bunch of stuff, vaccines, research, information. It tells everybody what's going on in the world. CDC is going to be monitoring and detecting problems and working with prevention primarily. We had our chapter on disasters, preparedness, biotourism, radiation. I'm going to skip that. Family crisis. What is a family crisis? Remember, family crisis is when someone says, I can't do this. Something has happened in the family and they just cannot function. Okay. We have two different things that look at our tools to see who is susceptible to certain things. So we have our genes that tell us that, and then we have our eco maps, and that's going to be who's around us, who's in our environment. So E for environment, right? And it's going to be, why do we care about someone's environment?
Because it can impact them in a positive or a negative way.
Yeah, they're going to associate and repeat behaviors that they see occurring naturally in their environment, right? So think about that. That's why so many teens get into other stuff, because it's going on all the time in their environments, right? Epidemiology, yay! All right, remember we had our triangle, we had our host, our agent, our environment. We know that these are all related. They're a triangle. One has to work with the other. And the goal is to break that up so that the agent doesn't spread. But we talked about different environments that make things susceptible. We had some rates that we did. Attack rate, case fatality rate, right? That's the one that says, will I survive? Case morbidity rate, crude mortality rate. So all of these are familiar terms of ours from epidemiology. We had surveillance and outbreak. We had 4 different types. Remember those? We talked a bit about different types of studies, right? Like our descriptive, our analytic. So just remember retro. I always tell people, remember retro means back in the day. Okay. Our 3 domains of learning, which are important. Somebody tell me about the 3 domains of learning.
Affective is the feelings, cognitive is like the thinking, and psychomotor is the physical,
Beautiful.
I think.
Excellent. Why do we care about domains of learning?
Because then you'll know how to teach.
Exactly. You'll know how to teach to different audiences, right? Some people learn better by thinking. Some people learn better by doing. Some people feel better by getting life stories and having feelings associated with it, right? So that's how we as nurses are always educating. Our migrant workers and our rural communities. Remember, we have a decrease in leisure activities when we're in these rural communities, right? We have them working all the time. Everybody knows everybody. So you're going to have all kinds of things not being reported.
Domestic abuse.
Good. What else?
STD.
Good. What else are people going to be ashamed of in a small community that they shouldn't be, but they are?
Pregnancy?
Maybe teen pregnancy or unwanted pregnancies. Absolutely. What else?
Mental health.
Yep. Mental health is the big one. Everybody's always afraid to say that there's something, that their brain doesn't work the same as others. Okay. So you're going to see a lot of that with our rural communities, which sort of takes us into abuse because that's something that is not reported. I'm not going to spend a ton of time on abuse. We did a chapter on home visits. So we're going to look at knowing that when we go into a home, we're going to respect that home regardless of what we see there, right? And why is it good to go to somebody's house?
Because you can see like if they have like those big old carpet things and like trip hazards, you can see what their life is like and adapt, like change their risk factors inside their house.
Good. You can keep them safe if they're old. What else?
We make sure the fridge and oven and stuff works and is on.
Mm-hmm. Yep, we're gonna do that too.
You can make sure they're taking their medicine like they're supposed to and it's organized, or it's
Yeah, organized meds. Remember, when we see a family, we get a lot of information because we see who's in the house, who's helping take care. We can also look there, what do they believe in? Like, what are their cultural beliefs? What kind of foods are they eating? What kind of pills are they taking? What kind of supplements are they taking? Are they drinking tea and thinking it'll lower their blood sugar? Right? So, no, also though, for us as nurses, we don't want to go in and wham them with all this social, like, hey, how's it going? That kind of stuff. You don't want to disclose too much to them when you first meet them, right? Because that's kind of, has anyone ever met someone and you're like, gosh, they told me their whole life in 5 minutes, right? You don't want to do that because it kind of makes you feel a little uncomfortable. So you want to slow down, take time, build your trust with your patients and their families, okay? Parish nursing, we talked about 2 different types. Congregational based, which is really autonomous. You're on your own. You're taking care of a congregation. Then we have our faith-based, assigned to a congregation, right? So we community-based as well, which was working with our communities, less autonomous, really. We just talked about this. Another slide on primary, secondary, and tertiary. So you're going to see that on HESI. Primary activities which take place, this is related to violence though. Activities that take place before violence has occurred. What's an example of a primary prevention for abuse?
Like setting up an education program.
Good. Maybe to kids or to
Yeah.
teens?
To adolescents to recognize the signs of abuse.
for sure.
Adolescents, good. And then secondary is going to be immediately after something has occurred, okay? So we're going to look at that short-term consequences. We're going to screen for what has happened. And then our long-term responses is going to be our tertiary, where we take care of them long-term, minimize its impact, further prevent further abuse from occurring, okay? We talked a lot about cultures, different cultures, sensitivity, foods, time orientation. Please recall that. And there are our lovely references. Guess what it is? Our textbook. Yay! Okay, so that's where our slides come from. Okay, and we took some images off the internet to make it a little more interesting. Okay, so that about covers our HESI review. I will ask, are there any questions? You have like a 53-page HESI review study guide. That's just so we cover everything, but I wouldn't commit everything on there to memory. Okay. What else do we have to say? Anything? What are we doing as students this week? We're going to be sending Professor Aloni an email for Monday or Tuesday of the following week, and just give me a time, okay? So do that. I'm going to let you guys go a little early tonight because I want you to study. I want you to read. I want you to do your very best, put your best foot forward, and just remember everything we've talked about. You guys know this content. I feel comfortable. I feel good that you guys are taking your HESI, and I wish everyone the best of luck. Please meet with me week, whatever we're at, 11, 12. Okay. No class next week. I'm crossing my fingers everyone does really well on the HESI, okay? So with
I have a
that, I say,
question.
yep.
It's a question for me. It was on one of these tests. It was about migrant workers and if like
Mhm.
the teacher or the nurse expected that the child wasn't getting enough sleep or something like that. Is it immediately reported to CPS or a different answer?
If it's sleep, no. If
Okay.
it's food, yes. If
Okay.
it's abuse of any type, yes.
Okay.
Sleep is one of those, like, you'd have to investigate a little further. I don't remember
Okay.
the question on the test. I mean,
Well, no, I think it was on the NCLEX questions or something.
oh.
And when I was reviewing, I couldn't remember which one but it just hit me the one I wanted to ask about.
Yeah, I mean, I would say, but my opinion on an NCLEX question, if it's ignore it, it's never ignore. And
Okay.
if
So
it's
I think it
call
was something like
CPS,
call CPS or talk to the parents about it
talk to the
first.
parent on sleep. That's would be the answer. All right, any other questions? I see it. Someone in the chat will meet with you after class. Everyone else, please study, do your best, send me an email. This gives you guys another like 20 minutes to do all that stuff, okay? All right, good night. Best of luck next week.
Good night. Thank you.
Sure.
Professor Lonnie,
Yep.
I just
Hold
want.
on. Hold on. I'm gonna
Oh.
stop recording.
Okay.